And welcome to my video blog. Thanks so much for joining me this week. I apologize again for the delay, but my exams are done, so now we're back on track. So today I want to talk about PCOS, which is Polycystic Ovarian Syndrome. And a lot of people think that this may not be a popular topic, and I want to just let you know that about 10% of women do have PCOS, and a lot of times I find this is extremely undiagnosed. I often see patients come into my office and they're struggling with acne or with weight gain, with insulin resistance, or with infertility, or with menstrual irregularities. And all these things are symptoms of PCOS, and oftentimes it goes undiagnosed. So today I want to give you an overview about exactly what it is, what symptoms that it might cause, and how you might treat it. So PCOS is basically your ovaries do produce a tiny amount of male hormones, your androgens. These are your testosterones, for example. And in PCOS, you'll start to have your ovaries make a little bit more of these hormones. And a little bit of hormone goes a long way. And so what happens when you have a higher circulating amount of male hormones, we all have them, they're not really male hormones, but your androgens and your testosterones in a woman's body, it can cause some big changes. So the first thing is that we see is sometimes she stops ovulating. So this you may not even notice if you're not trying to get pregnant, but if you are trying to get pregnant, this can be a big concern. So you may not know that you have PCOS for years and years and years, and then when you do decide that you want to become pregnant, it's very difficult to do so, or impossible, and this can be really stressful for your relationship, and this might lead you to take some more drastic measures like doing IVF when really you don't need to. You just need the diagnosis of PCOS so it can be treated appropriately. The other thing that it might do is cause you to have longer menstrual cycles. So some of these women may have cycles over 40 days long between your periods. So if you're noticing that, again, that's because of the high levels of androgens in your system. Again, the high levels of androgens can cause acne. So if you're struggling with acne and you are, past your peripubescent phase of life and it's still a struggle for you, this could be something to look into. And the extra androgens can also cause you to grow hair in places that women don't typically have hair. So you may have facial hair, a little bit of hair around the chin, some hair sort of in this area here. It can also cause more body hair on the back, on the arms. If you're noticing that your hair is longer, or if it's denser or darker than maybe would be equivalent for your ethnicity, that's something to look into. It could be because of high androgens. The other thing that PCOS can lead to is having insulin resistance. So we've talked about this a couple times before on our video blog here, but insulin resistance basically is a precursor to diabetes. So this means that the cells in your body have, insulin is what allows the cells in your body to basically eat up the glucose that's floating around in your bloodstream from the meal that you just ate. So if your cells then have the insulin, allows them to eat up that glucose, then your cells can then burn that glucose and use it for energy. So if you have insulin resistance, this is not happening as efficiently in your body as it could be. And again, this predisposes you to developing diabetes later on down the line, but it also causes you to have increased weight gain and increased difficulty losing weight. So if this is a problem for you, this could be because you have insulin resistance. It also makes it makes your sleep less restful and you can be more fatigued. So again, I'll just give you a full rundown of all the symptoms of PCOS. They could be acne, weight gain, difficulty losing weight, especially if you have weight in the abdominal region. It can be extra hair on the face or on different parts of the body. It could also be hair loss or thinning of the hair on the scalp. That's another symptom. Irregular periods, long period cycles, lack of ovulation, which could be noted in a fertility problem. And also it's associated with depression. So if something that you struggle with is also depression, again, something to look into would be PCOS. So how do you diagnose PCOS? The first thing that I would do is send you for hormone testing. I would send you for a simple blood test, and we basically look at different ratios of the hormones in your body to see how they're functioning, and we'll also look at the androgens in your body to see if those are in excess when they shouldn't be. We would also send you for testing for insulin resistance. So again, noting whether or not you do have the insulin resistance is another factor in PCOS, but it also can be a product of having other different conditions and concerns. So it's not always noted with PCOS, but it's often there. The other thing that we can send you for is an ultrasound. Now, if they do an ultrasound and you have cysts on your ovaries, obviously that can be a symptom of PCOS, but you don't need to have that in order to have the diagnosis of PCOS. So someone could have all the hormonal things going on and be diagnosed with PCOS without actually physically having those cysts on their ovaries, as seen in an ultrasound. So I would encourage you to go for testing if that's a concern for you, if you're noticing these symptoms, because then it can allow us to treat you appropriately and effectively. So the way that a naturopathic doctor treats, let's talk about the way a medical doctor would treat PCOS. And the way they do that is typically with the birth control pill. Basically, what the idea there is that they're going to regulate your hormones. They're going to take over for your body and regulate the hormones using a pill rather than allowing your body to regulate its own hormones, which is fine and helpful in some women, but we have natural ways of treating PCOS as well. The first way that we do is by treating your insulin resistance. The easiest way to do that is exercise. Exercise basically allows your cells to eat up that glucose more effectively. It reduces insulin resistance in the body and is really effective in reversing the process of insulin resistance. We can also do it through diet. The way we would recommend doing that is by having protein with all of your meals and with having more frequent, smaller meals throughout the day. This keeps your blood sugar nice and stabilized and balanced rather than promoting this spike and fall type pattern that we often see in patients. We would also have to avoid sugar binges, carb loading, and things like pop and alcohol binges as well. Can also all spike your blood sugar up. Again, we want to keep this nice and balanced with having good fats and good sources of protein with all your meals. We can also supplement to help control your blood sugar if that's something that we can't do with diet alone. There are lots of effective supplements out there that can help to balance it on out. The next thing that we're going to do is balance out your hormones. So we talked about having those high levels of traditionally male hormones. What we would do is herbal supplements are very effective at reducing the amount of testosterone that's circulating in the body. And again, that's going to help with acne, with the hair growth and the hair loss on the top of the head. It's also, we can modulate your levels of estrogen and your levels of progesterone, which are your typically female sex hormones. And when you balance all these hormones out, you're going to start ovulating more regularly. You're going to start having more normal menstrual cycles. The next thing that we are going to do is support your nutrients. There are some really interesting studies about vitamin D out there. So vitamin D deficiency is really, really prevalent in Canada. Obviously, our long winters don't allow us to get a lot of sun exposure, and that's going to prevent us from having optimal levels of vitamin D. Now, studies show that if you supplement women with PCOS with vitamin D, it's going to improve their menstrual frequency and improve their fertility. It's also going to reduce the testosterone, which of course again reduces the acne and the inappropriate hair growth or hair loss. And it's also going to reduce your insulin resistance. So vitamin D is something that's super simple, but it can go a really long way in a woman with PCOS. So you can get your vitamin D tested. You have to do this privately. Unfortunately, OHIP no longer funds testing because everybody's deficient, so they won't test you for it. They just assume that you are deficient. But you can get it tested through your naturopathic doctor if that's something you'd like to look into. But you can also go outside into the sunshine. You can take a vitamin D supplement, but please do ask your naturopathic doctor about the dosage that's right for you. So I hope you found this video blog interesting, and I hope that it maybe is getting you thinking about some other things that could be going on in your body that you may be unaware of, so that you can get tested and that you can get treated properly. So you can go to my website at www.hillarybooth.com, and you can contact me from the contact page there, or you can contact me through Facebook. I'd be happy to help you book an appointment, or you can call our office and you can book an appointment with one of our receptionists through there. Thanks so much for watching, everybody. Have a great week.